Welcome home. Now that you've been discharged from the hospital, you're taking a very important step in your recovery. By continuing your treatment with lovenox, you're able to reduce the risk of a serious health complication while you recuperate at home. Through this video and the educational materials in your At Home with Lovenox kit, I'll help you learn everything you need to know about continuing your lovenox treatments on your own. It's not as difficult as you might think, so let's get started. As you've probably already learned, a DVT blood clot, also called deep vein thrombosis, forms deep in the veins of your legs. Hi, Mr. Hillman. How are you today?
Oh, pretty good.
Your risk for DVT is higher if you have certain health conditions, especially if you've been hospitalized or spending an extended period of time off your feet to recover from an illness, injury, or surgery. If a DVT blood clot breaks free and travels to your lungs, it can cause a pulmonary embolism, which can be potentially fatal. Lovenox can help protect you against the risk of these complications, which is why it's important to continue your lovenox treatments just as your doctor prescribed. That means making sure you complete your full course of therapy by using all the syringes you've been given by your pharmacist. This At Home with Lovenox kit will help guide you through the steps for injecting lovenox safely and easily at home. Please take a few minutes to read through the materials included in your kit and familiarize yourself with all the pieces.
Let's see what's in here. Oh, good. Everything's listed right here.
The nurse showed me this brochure in the hospital. Looks like everything I need to know is here.
And here's the free Know Your Risk program. It says you get newsletters and things. That's good. You get more information about DVT.
Oh, yeah, I have to remember to sign up. The doctor said I may be at risk for DVT blood clots in the future, like if I'm admitted to the hospital again.
Well, it's always good to know about these things, isn't it?
Let me take a moment to show you this helpful daily injection record in the brochure. Here, you'll notice a place to keep a daily record of your injections, which will help you remember to alternate sides. There is also this illustration next to the tracking chart, which can help you visualize your abdomen. Use it to mark where your injection sites are located. In the back pocket of the brochure, you'll also find a quick reference card. Once you've become more familiar with your lovenox treatments, this can be your cheat sheet. It's important to take lovenox at the same time each day, so there's also a cling sticker that will adhere to any smooth surface, like a bathroom mirror, to remind you of your injection time each day. Your kit also contains alcohol swabs for cleaning your injection areas, and a container for the safe disposal of your syringes after you're finished with each dose, called a sharps collector. When you fill your lovenox prescription, your pharmacist will give you the exact number of syringes your doctor has prescribed for you. If you have any questions about it, you should talk to your physician. If you've never given yourself injections before, it's normal to be a bit nervous or apprehensive, but you can do it. Millions of other lovenox patients just like you have too. Each lovenox syringe comes pre-filled, which means the medication for each dose is already inside the syringe and is ready to be used as directed by your physician. Lovenox comes in different strengths, so your packaging and syringe may be a different color than this one. You'll notice that the needle is only about a ½ inch long, just enough so that the medication enters the layer of fatty tissue under your skin. The needle is also extremely thin to help minimize discomfort. Lovenox is injected into that inch of pinch that's to the right or left of your abdomen, here or here. A great way to remember this is to think lovenox, love handles. You can inject lovenox yourself or have a family member or caregiver do it for you. The steps are simple, and they get easier with each treatment. You probably remember the nurses giving you these shots in the hospital, so you know that they're not painful. You'll be taking lovenox once or twice daily, as your doctor has prescribed. It's important to try to take each dose at the same time each day. Don't skip any doses or take any more than prescribed. Continue the injections for exactly the number of days your doctor has specified. Now, let's review the procedure. This would be a good time to view this video with a family member or caregiver if they will be assisting you with your lovenox injection. First, wash your hands well with soap and warm water and dry them thoroughly. Now you'll need a place to sit or lie down. It's important that you can relax comfortably with your body firmly supported, yet still easily see your abdomen and where you will be injecting. Your sharps collector should be within easy reach. Remove the lid to have it open and ready. The injection can be given on either the left or right side of your stomach, as long as it's at least 2 inches away from your belly button and out toward your waist. Again, think love handles. It's a simple way to remember. Whether you choose the right or left side to begin your treatments at home, you should alternate sides with each shot. Be sure to avoid injecting bruised or scarred areas. Use one of the alcohol swabs in your kit to clean the area you are about to inject and let it dry. Firmly pull the cap off of the syringe. Do not twist the cap because this can bend the needle. Now, discard the needle cap into the sharps container. Do not put the needle down or allow it to touch anything. This will help to keep it sterile. You will notice that each syringe has a bubble inside. It's okay for you to inject this bubble into your skin. Don't try to squirt the bubble out, as you may lose some of the drug and not get the full dose. If your physician has prescribed less than a full syringe, hold the syringe with the needle pointing down, but close enough so that you can read the writing. Then expel the excess portion and tap it off until the contents align with the dosage that the physician has prescribed. Now place the syringe in the hand you write with and hold it like a pencil. With your other hand, gently pinch the cleansed area between your thumb and your forefinger to make a fold in your skin. You will need to hold the skin fold throughout the injection. This way, the needle enters soft, fatty tissue and not muscle. It is important not to inject your muscle, as this can cause bleeding or bruising. Fortunately, most of us don't have any trouble finding an inch of pinch on our stomach. Now insert the full length of the needle straight up and down at a 90-degree angle into the fold of skin. Don't worry, it will enter easily. When the needle is all the way in, press down on the plunger with your finger. Keep holding the fold of skin until the syringe is empty. Then, pull the needle straight out, keeping your finger on the plunger rod. To avoid bruising, do not rub the injection site. You're almost done. The final step is to dispose of the syringe. All lovenox syringes feature a safety system that covers the needle after the injection. Pointing the needle downwards and away from yourself and others. Activate the lovenox safety device by firmly pushing the plunger rod. The protective sleeve will automatically cover the needle, and you'll hear a click, confirming that the shield has activated. Now place the empty syringe into the sharps collector with the needle point facing down. If you are unable to physically activate the safety system, carefully insert the used needle with the needle point facing down into the sharps collector for disposal. Be sure to replace and tighten the lid on your sharps collector, and remember to store your pre-filled syringes, as well as your sharps collector, in a safe place, out of the reach of children. When the sharps collector is full, contact your healthcare professional or pharmacist for disposal instructions. That's all there is to it. If you have any questions at all, talk to your healthcare provider. Continue using lovenox as prescribed by your doctor for as long as your doctor indicated. This is critical to help ensure lovenox works the way it was intended. You should also follow your doctor's instructions regarding your other medications and any laboratory testing your physician may have ordered. If you experience any side effects, be sure to contact your healthcare provider immediately. For more information about the use of lovenox or the proper technique for self-injection, call your doctor or the 800 number on your screen. Being in charge of your health is important. One simple thing you can do is sign up for the free Know Your Risk program. You'll receive additional helpful information about DVT blood clots and steps you can take to protect yourself from their risks in the future. Simply complete and return the postage-paid reply card in your brochure, or sign up online at www.lovenox.com. On behalf of Sanofi Aventis, best wishes for your speedy recovery.
What a beautiful day for a walk.
Important safety information. Lovenox, enoxaparin sodium injection, is not the same as unfractionated heparin or other drugs called low molecular weight heparins. Therefore, these drugs cannot be used interchangeably with Lovenox. Certain procedures called epidural, spinal anesthesia, and spinal puncture may be used as a normal part of hospitalization. Patients requiring these procedures while being treated with Lovenox or other low molecular weight heparins are at risk of developing a blood clot in or around the spine. This condition may result in long-term or permanent paralysis. Lovenox can alter the blood's ability to clot. Patients treated with Lovenox who also have conditions affecting the clotting system must be carefully monitored by their physician. Adjusting the dose of lovenox may be necessary for patients who have certain forms of kidney disease. All patients receiving lovenox, as well as other anticoagulants, should be carefully monitored for bleeding by their physician. Bleeding can occur at any site with lovenox use. Platelet drops, known as thrombocytopenia, can occur with lovenox use. Cases of a related condition called heparin-induced thrombocytopenia have been observed in clinical practice. If you have had this condition, you must notify your healthcare professional. Your physician may perform blood tests to monitor for the occurrence of any drop in platelet count. The use of lovenox has not been adequately studied in pregnant women with artificial mechanical heart valves. Lovenox should not be used in patients with an allergy or sensitivity reaction to the active ingredient called enoxaparin sodium, heparin, or pork products, and in patients with active major bleeding. Common side effects include mild local reactions or irritation at the site of injection, pain, bruising, and redness of skin. For specific questions about your health, you should always consult your physician or a qualified healthcare professional who is responsible for your care. Please see accompanying full prescribing information, including boxed warning for additional important information.